Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. Which vein is most commonly used for venipuncture? A. Basilic vein, B. Cephalic vein, C. Median cubital vein, and D. Metacarpal veins. The answer is C. Median cubital vein. Number 2. Which of the following is the correct order of draw in venipuncture? A. Heparin, EDTA, serum. B. Serum, heparin, EDTA. C. EDTA, serum, heparin. And D. Serum, EDTA, heparin. The answer is B. Serum, heparin, EDTA. Number 3. What is a crucial step to prevent contamination in venipuncture? A. Applying a tourniquet. B. Selecting a vein. D. Disinfecting the venipuncture site. Or D. Labeling the blood sample tubes. The answer is C. Disinfecting the venipuncture sites. Number 4. Which of the following is essential for ensuring patient comfort during venipuncture? A. Using a large bore needle. B. Performing the procedure quickly. C. Communicating and explaining the procedure to the patient. Or D. Applying the tourniquet very tightly. The answer is C. Communicating and explaining the procedure to the patient. Number 5. What should be done immediately after withdrawing the needle from the patient's vein in a venipuncture procedure? A. Label the tubes. B. Apply pressure to the venipuncture site with a gauze pad. C. Dispose of the needle in a sharps container. Or D. Mix the tubes. The answer is B. Apply pressure to the venipuncture site with a gauze pad. Number 6. Which antiseptic is commonly used for routine venipunctures? A. Alcohol. B. Iodine. C. Hydrogen peroxide. Or D. Chlorhexidine. The answer is A. Alcohol. Number 7. In which scenario is the use of a syringe for venipuncture most appropriate? A. When large volumes of blood are needed. B. With older adult patients. C. When using a butterfly needle. Or D. With patients having delicate or small veins. The answer is D. With patients having delicate or small veins. Number 8. Which colored tube top is typically used for coagulation testing? A. Blue. B. Red. C. Green. Or D. Lavender. The answer is A. Blue. Number 9. How should the bevel of the needle be positioned during venipuncture? A. Facing downward. B. Parallel to the vein. C. Facing upward. Or D. At a 90-degree angle to the vein. The answer is C. Facing upwards. Number 10. Which gauge of needle is most commonly used for routine venipunctures? A. 18 gauge. B. 21 gauge. C. 22 gauge. Or D. 25 gauge. The answer is B. 21 gauge. Number 11. What should be the maximum time limit for a tourniquet to remain on the arm during venipuncture? A. 1 minute, B. 2 minutes, C. 3 minutes, or D. 5 minutes? The answer is A. 1 minute. Number 12. Which tube should be drawn first when using a butterfly needle? A. Heparin tube, B. EDTA tube, C. Blood culture tube, or D. Serum tube? The answer is C. Blood culture tube. Number 13. How should the patient's arm be positioned during venipuncture? A. Slightly elevated, B. Straight and well supported, C. Bent at the elbow, D. Lower than the heart? The answer is B. Straight and well supported. Number 14. Which department in the laboratory typically processes CBC tests? A. Chemistry, B. Hematology, C. Microbiology, or D. Immunology? The answer is B. Hematology. Number 15. What information is essential to verify with the patient before beginning the venipuncture procedure? A. Age and gender, B. Last meal consumed, C. Name and date of birth, or D. Medical history? The answer is C. Name and date of birth. Number 16. What is the primary reason for inverting the tubes after collection during venipuncture? A. To mix anticoagulants, B. To prevent clotting, or C. To ensure volume accuracy, or D. To avoid hemolysis? The answer is A. To mix anticoagulants. Number 17. Which action is necessary if a patient appears to faint during a venipuncture procedure? A. Continue drawing blood, then assess the patient. B. Immediately remove the tourniquet and needle and lower the patient's head. C. Ask the patient to sit up straight and continue the procedure quickly. Or D. Leave the patient momentarily to seek help. The answer is B. Immediately remove the tourniquet and needle and lower the patient's head. Number 18. Which is the preferred site for capillary puncture in adults? A. Earlobe, B. Fingertip, C. Heel, D. Thumb? The answer is B. Fingertip. Number 19. Which is an essential quality of a good phlebotomist? A. Speed, B. Precision, C. Compassion, D. Strength? The answer is C. Compassion. Number 20. For which type of test is fasting usually required? A. CBC, B. Lipid panel, C. Complete metabolic panel, or D. Hemoglobin A1C? The answer is B. Lipid panel. Number 21. What must be done when labeling the blood specimen tubes? A. Patient's first name only, B. Patient's full name and date of birth, C. Phlebotomist's initials and date, or D. Both B and C? The answer is D. Both B and C. Number 22. Which of the following tubes is used for a glucose test? A. Gray top, B. Green top, C. Purple top, or D. Red top? The answer is A. Gray top. Number 23. What should be done in case of a needle stick injury? A. Continue with the procedure, B. Wash the area with soap and water and report the incident, C. Apply alcohol to the area, D. Ignore it unless there is visible blood? The answer is B. Wash the area with soap and water and report the incident. Number 24. How many times can a phlebotomist attempt to draw blood from a patient? A. Once, B, twice, C, 3 times, or D, as many times as necessary? The answer is B, twice. Number 25. Where should the tourniquet be placed during venipuncture? A, just above the elbow. B, above the wrist. C, at the midpoint of the upper arm. Or D, anywhere on the arm? The answer is A, just above the elbow. Number 26. What is the primary purpose of the rubber sleeve on the venipuncture needle? A, comfort for the phlebotomist. B, to prevent backflow. C, for needle safety after venipuncture. Or D, anesthetic purposes? The answer is C, for needle safety after venipuncture. Number 27. Which angle is ideal for needle insertion during venipuncture? A, 15 to 30 degrees. B, 30 to 45 degrees. C, 45 to 60 degrees. Or D, 90 degrees? The answer is A, 15 to 30 degrees. Number 28. Which test requires the blood sample to be protected from light? A, CBC. B, sodium. C, bilirubin. Or D, potassium? The answer is C, bilirubin. Number 29. What is a common complication of venipuncture? A, hemolysis. B, infection. C, fever. Or D, allergic reaction? The answer is A, hemolysis. Number 30. When using a multi-sample needle for venipuncture, what should you do if the first tube does not fill with blood? A, remove the tube and try a different one. B, reposition the needle. C, remove the needle and try with a new one. Or D, ask the patient to make a fist? The answer is B, reposition the needle. Number 31. What kind of consent is required before performing venipuncture? A, written consent. B, verbal consent. C, implied consent. Or D, no consent is needed? The answer is C, implied consent. Number 32. Which of the following is a crucial step to prevent hemolysis? A, mixing the tube vigorously. B, using a large gauge needle. C, drawing the blood quickly. Or D, ensuring the tourniquet is not too tight or left on too long? The answer is D, ensuring the tourniquet is not too tight or left on too long. Number 33. Which department is responsible for blood culture tests? A, microbiology. B, hematology. C, immunology. Or D, chemistry? The answer is A, microbiology. Number 34. Why is the order of draw important in phlebotomy? A, to prevent discomfort for the patient. B, to prevent cross-contamination of additives between tubes. C, to ensure fast filling of tubes. Or D, to match the laboratory's processing sequence? The answer is B, to prevent cross-contamination of additives between tubes. Number 35. What should a phlebotomist do if a patient refuses a blood draw? A, persuade the patient aggressively. B, proceed with the draw, explaining its essential. C, inform the patient's healthcare provider and document the refusal. D, ask a colleague to perform the draw. The answer is C, inform the patient's healthcare provider and document the refusal. Number 36. Which tube is primarily used for hematology testing? A, red top. B, lavender top. C, green top. Or D, blue top? The answer is B, lavender top. Number 37. Which personal protective equipment, PPE, is necessary for a routine venipuncture? A, gloves only. B, gloves and gown. C, gloves and mask. Or D, gloves, mask, and goggles? The answer is A, gloves only. Number 38. What is the first thing a phlebotomist should do if a patient has a syncope episode during a blood draw? A, finish the blood draw quickly. B, lay the patient down or sit them in a chair with their head between their knees. C, remove the needle immediately. Or D, call for medical assistance. The answer is B, lay the patient down or sit them in a chair with their head between their knees. Number 39. What is the proper procedure for a heel stick on an infant? A, warm the heel, cleanse the site, and puncture the heel. B, cleanse the site, puncture the heel, and then apply bandage. C, puncture the heel, cleanse the site, and collect the specimen. Or D, cleanse the site, apply a bandage, and puncture the heel. The answer is A, warm the heel, cleanse the site, and puncture the heel. Number 40. Which agency sets the standards for phlebotomy procedures? A, FDA, B, CLIA, C, CDC, or D, OSHA? The answer is D, OSHA. Number 41. Which department would process a PT/INR test? A, coagulation, B, hematology, C, chemistry, or D, immunology. Number 42. What should be done with the needle used for venipuncture immediately after the procedure? A, recapped and disposed of in a sharps container. B, left on the tray for later disposal. C, directly disposed of in the sharps container. Or D, cleaned and sterilized for reuse. The answer is C, directly disposed of in the sharps container. Number 43. Which sample requires chilling immediately after collection? A, CBC, B, ammonia, D, blood culture, or D, hemoglobin? The answer is B, ammonia. Number 44. Which veins are commonly used for venipuncture in the antecubital area? A, radial, brachial, and ulnar. B, median cubital, cephalic, and basilic. C, jugular, subclavian, and auxiliary. D, temporal, facial, and carotid. The answer is B, median cubital, cephalic, and basilic. Number 45. What is the minimum information required on a specimen label? A, patient's name and date of birth. D, date and time of collection. C, phlebotomist's initials. Or D, all of the above? The answer is D, all of the above. Number 46. Which blood culture bottle should be inoculated first? A, aerobic, B, anaerobic, C, both at the same time, or D, does not matter? The answer is A, aerobic. Number 47. Which finger is most suitable for a capillary puncture? A, index finger, B, middle finger, C, ring finger, or D, thumb? The answer is C, ring finger. Number 48. What is the appropriate depth for a heel stick on a newborn? A, 1.0 millimeters, B, 2.0 millimeters, C, 3.0 millimeters, and D, 4.0 millimeters. The answer is B. Number 49. Which of the following may lead to a hemolyzed specimen? A, using a needle that is too small. B, vigorously shaping the tube. C, prolonged tourniquet application. Or D, all of the above? The answer is D, all of the above. Number 50. Which type of consent is assumed when a patient extends their arm for a blood draw? A, informed consent, B, written consent, C, implied consent, or D, verbal consent? The answer is C, implied consent. Number 51. What is the most important step in avoiding pre-analytical errors? A, proper patient identification. B, correct order of draw. C, adequate mixing of tubes. Or D, correct labeling. The answer is A, proper patient identification. Number 52. Which tube should be used for a blood alcohol level test? A, red top. B, gray top. C, blue top. Or D, green top. The answer is B, gray top. Number 53. Where should the first drop of blood be wiped away during a skin puncture? A, on the patient's skin. B, on a gauze pad. C, on the first collection tube. Or D, it should not be wiped away. The answer is B, on a gauze pad. What does the term phlebotomy literally mean? A, vein opening. B, vein insertion. C, vein cut. Or D, blood draw. The answer is C, vein cut. Number 55. Which of the following is a common symptom of a patient experiencing vasovagal syncope? A, fever. B, dizziness. C, hyperventilation. Or D, chest pain. The answer is B, dizziness. Number 56. How should the blood smear for a differential blood count be made? A, using 2 glass slides. B, using a specialized smear-making device. C, using the edge of another blood collection tube. Or D, using a cotton swab. The answer is A, using 2 glass slides. Number 57. Which vein is usually the last choice for venipuncture? A, median cubital vein. B, cephalic vein. C, basilic vein. Or D, dorsal metacarpal veins. The answer is C, basilic vein. Number 58. What is the first step in phlebotomy procedures? A, applying the tourniquet. B, cleaning the venipuncture site. C, identifying the patient. Or D, assembling equipment. The answer is C, identifying the patient. Number 59. Which of the following may cause erroneous laboratory results? A, prolonged tourniquet application. B, inadequate fasting. C, hemolysis. Or D, all of the above. The answer is D, all of the above. Number 60. What is the appropriate angle for needle insertion during a heel stick on a newborn? A, perpendicular, 90 degrees. B, 45 degrees. C, 30 degrees. Or D, parallel to the heel surface. The answer is D, parallel to the heel surface. Number 61. What precautions should be taken when collecting a blood specimen from an arm with a hematoma? A, avoid the area, choose another site. B, apply extra pressure during venipuncture. C, use a smaller gauge needle. Or D, perform the venipuncture above the hematoma. The answer is A, avoid the area, choose another site. Number 62. How long should pressure be applied to the venipuncture site after needle removal? A, until bleeding stops. B, for at least 1 minute. C, for 2 to 3 minutes. Or D, until the patient feels comfortable. The answer is A, until bleeding stops. Number 63. What is the recommended depth for a finger stick on an adult? A, 1.0 to 2.0 millimeters. B, 2.0 to 3.0 millimeters. C, 3.0 to 4.0 millimeters. or D, 4.0 to 5.0 millimeters? The answer is A, 1.0 to 2.0 millimeters. Number 64. What is the main complication of a needle stick injury from a used phlebotomy needle? A, hematoma formation, B, infection or disease transmission, C, allergic reaction, or D, inflammation. The answer is B, infection or disease transmission. Number 65. Which additive is commonly found in a tube with a green top? A, EDTA, B, citrate, C, heparin, or D, oxalate? The answer is C, heparin. Number 66. Which of the following is a complication associated with venipuncture? A, septicemia, B, petechiae, C, hematoma, or D, all of the above? The answer is D, all of the above. Number 67. Which tube additive is best for collecting an ethanol specimen? A, sodium fluoride, B, EDTA, C, heparin, or D, citrate? The answer is A, sodium fluoride. How should a phlebotomist identify a patient in a non-hospital setting? A, by room number, B, by asking the patient to state their name and date of birth, C, by the patient's bed label, or D, by calling the patient's name in the waiting room? The answer is B, by asking the patient to state their name and date of birth. Number 69. What colored tube should be used to collect a CBC? A, red, B, lavender, C, green, or D, yellow? The answer is B, lavender. Number 70. Which gauge of needle is most commonly used for routine venipuncture? A, 21 to 23 gauge, B, 15 to 18 gauge, C, 25 to 26 gauge, or D, 30 gauge? The answer is A, 21 to 23 gauge. Number 71. What is the term for the process of slapping a vein to make it more prominent? A, vein slapping, B, palpitating, C, dorsiflexion, or D, milking? The answer is D, milking. Number 72. What is the best approach when a patient is afraid of needles? A, tell the patient to look away and not be a baby. B, reassure the patient, explain the process, and proceed calmly and confidently. C, ignore the patient's fear and proceed. D, ask another phlebotomist to do it. The answer is B, reassure the patient, explain the process, and proceed calmly and confidently. Number 73. Which of the following is essential for the phlebotomist to ensure the quality of the blood specimen? A, proper patient preparation, B, correct order of draw, C, correct labeling of specimen, or D, all of the above? The answer is D, all of the above. Number 74. Which test requires a chain of custody protocol? A, glucose, B, drug screening, C, complete blood count, CBC, or D, electrolytes? The answer is B, drug screening. Number 75. What information should be included on a specimen label? A, patient's full name and identification number, B, date and time of collection, C, phlebotomist's initials, or D, all of the above? The answer is D, all of the above. Number 76. What is the recommended site for a capillary puncture on an adult? A, tip of the finger, B, side of the fingertip, C, side of the heel, or D, palm of the hand? The answer is B, side of the fingertip. Number 77. Which is the correct order of draw for capillary collections? A. EDTA tubes, other additive tubes, serum tubes. B. Serum tubes, EDTA tubes, other additive tubes. C. Other additive tubes, serum tubes, EDTA tubes. Or D. Serum tubes, other additive tubes, EDTA tubes. The answer is A. EDTA tubes, other additive tubes, or serum tubes. Number 78. What is the maximum recommended depth for a heel puncture on a newborn? A. 1.0 millimeters, B. 2.4 millimeters, C. 3.0 millimeters, or D. 4.0 millimeters. The answer is B. 2.4 millimeters. Number 79. Which of the following is a potential consequence of not properly shaking an additive tube? A. Hemolysis, B. Clotting, C. Contamination, or D. Inaccurate test results. The answer is D. Inaccurate test results. Number 80. What is a key factor in choosing the venipuncture site? A. Convenience for the phlebotomist, B. Size of the vein, C. Patient comfort, or D. Distance from the heart. The answer is B. Size of the vein. Number 81. What is the appropriate action if a patient is found to be eating during a fasting blood draw? A. Proceed with the draw, B. Cancel the draw, C. Wait for the patient to finish eating, then proceed, or D. Inform the patient's healthcare provider. The answer is D. Inform the patient's healthcare provider. Number 82. What is an antiseptic commonly used for blood culture collections? A. Isopropyl alcohol, B. Iodine, C. Hydrogen peroxide, or D. Chlorhexidine. The answer is B. Iodine. Number 83. Which of the following may result in a specimen rejection? A. Incorrect label, B. Hemolysis, C. Clotted specimen in an EDA tube, or D. All of the above. The answer is D. All of the above. How should a phlebotomist handle a patient with a needle phobia? A. Minimize the fear by acting swiftly without explaining the procedure. B. Suggest the patient look away and take deep breaths during the procedure. C. Tell the patient that there's nothing to be afraid of. D. Ask a colleague to perform the draw instead. The answer is B. Suggest that the patient look away and take deep breaths during the procedure. Number 85. What is the preferred method of blood collection in neonates? A. Venipuncture, B. Heel stick, C. Finger stick, or D. Arterial puncture. The answer is B. Heel stick. Number 86. Which of the following tubes should be filled last in the order of draw? A. EDTA, B. Serum separator tube, C. Heparin, or D. Citrate. The answer is B. Serum separator tube. Number 87. How many times should a lavender top tube be inverted after collection? A. 3 to 4 times, B. 5 to 6 times, C. 8 to 10 times, or D. 1 to 2 times. The answer is B. 5 to 6 times. Number 88. What information is necessary for the lab information system when processing a specimen? A. Phlebotomist's name, B. Patient's clinical history, C. Type of requested test, or D. Patient's insurance details. The answer is C. Type of requested test. What should a phlebotomist do in case of an accidental needle stick injury? A. Wash the area with soap and water, then report the incident. B. Continue the procedure, then clean the injury. C. Apply an antiseptic and a bandage. D. Immediately report to the supervisor without cleaning the wound. The answer is A. Wash the area with soap and water, then report the incident. Number 90. In which type of isolation should the phlebotomist wear a gown, mask, and gloves? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Protective isolation. The answer is A. Airborne precautions. Number 91. Which additive is used to prevent clotting by removing calcium through the formation of insoluble calcium salts? A. EDTA. B. Heparin. C. Citrate. Or D. Oxalate. The answer is A. EDTA. Number 92. In which department are coagulation studies usually performed? A. Hematology. B. Chemistry. C. Coagulation. Or D. Immunology. The answer is C. Coagulation. Number 93. Which of the following is the most critical error a phlebotomist can make? A. Mislabeling a specimen. Collecting a specimen at the wrong time. Causing a hematoma. Or not following the order of draw. The answer is A. Mislabeling a specimen. Number 94. Which of the following is a correct statement about arterial puncture? A. It is commonly used for routine phlebotomy procedures. It is usually performed on the wrist or the groin. C. It requires the use of a tourniquet. Or D. It is less painful than venipuncture. The answer is B. It is usually performed on the wrist or the groin. Number 95. In a glucose tolerance test, when should the timing begin? A. After the patient finishes the glucose solution. B. Before the patient drinks the glucose solution. C. As soon as the fasting specimen is collected. And D. When the patient arrives at the lab. The answer is A. After the patient finishes the glucose solution. Number 96. Which agency sets standards for phlebotomy procedures? A. FDA. B. CDC. C. CLSI. Or D. OSHA. The answer is C. CLSI. 97. Which of the following is an acceptable antiseptic for routine venipuncture? A. Povidone iodine. B. Hydrogen peroxide. C. Benzalkonium chloride. Or D. Isopropyl alcohol. The answer is D. Isopropyl alcohol. Number 98. What should be done with a needle after use in a venipuncture procedure? A. Recap it. B. Dispose of it in a regular waste bin. C. Place it immediately in a sharps container. Or D. Sterilize and reuse. The answer is C. Place it immediately in a sharps container. Number 99. Which of the following tubes is used for trace element testing? A. Royal blue. B. Red. C. Green. D. Black. The answer is A. Royal blue. Number 100. In what circumstance is it appropriate to perform a blind stick during venipuncture? A. When the patient is obese. B. When veins are not visible but can be palpated. C. Never. Or D. When smaller needles are used. The answer is C. Never. Number 101. What is the purpose of warming the site before a capillary puncture? A. To reduce infection. B. To reduce pain. C. To enhance blood flow. Or D. Sterilize the site. The answer is C. To enhance blood flow. Number 102. Which of the following tests measure the oxygen carrying capacity of hemoglobin? Number A. HbA1c. B. CBC. C. Hematocrit. Or D. Arterial blood gases, ABG. The answer is C, hematocrit. Which of the following additives activates thrombin to shorten clotting time in a tube? A. EDTA, B. heparin, C. thrombin, or D. citrate? The answer is C. thrombin. Number 104. Which of the following represents the best practice when labeling a specimen tube? A. Before the draw, B. Immediately after the draw in the presence of the patient, C. After leaving the patient's room, or D. In the lab before processing? The answer is B. Immediately after the draw in the presence of the patient. Number 105. What is a critical step to prevent the contamination of a blood culture specimen? A. Applying a tourniquet, B. Proper cleansing of the venipuncture site, C. Using a large volume tube, or D. Drawing blood culture tubes last order of the draw? The answer is B. Proper cleansing the venipuncture site. Number 106. Which of the following is a common site for arterial blood gas, ABG? A. Brachial artery, C. Radial artery, C. Femoral artery, or D. Ulnar artery? The answer is B. Radial artery. Number 107. Which anticoagulant additive is used for PT/INR testing? A. Citrate, B. Heparin, C. EDTA, or D. Oxalate? The answer is A. Citrate. Number 108. Which finger is typically used for capillary puncture in an adult? A. Index finger, B. Middle finger, C. Ring finger, or D. Pinky finger? The answer is C. Ring finger. Number 109. What is the proper angle of needle insertion during a venipuncture? A. 15 to 30 degrees, B. 45 degrees, C. 60 degrees, or D. 90 degrees? The answer is A. 15 to 30 degrees. Number 110. Which department in the clinical laboratory performs tests to identify abnormalities of the blood cells? A. Hematology, B. Chemistry, C. Microbiology, or D. Coagulation? The answer is A. Hematology. Number 111. Which of the following would lead to a rejected specimen due to identification error? A. Misspelled patient name, B. Incorrect patient date of birth, C. Lack of phlebotomist's initials, or D. All of the above? The answer is D. All of the above. Number 112. How should a phlebotomist prepare a site for a blood alcohol test? A. With iodine, B. With isopropyl alcohol, C. With benzalkonium chloride, or D. With soap and water? The answer is C. With benzalkonium chloride. Number 113. Which of the following best describes the anatomical location of the median cubital vein? A. On the thumb side of the wrist, B. At the bend of the elbow, middle of the arm, C. On the little finger side of the wrist, or D. On the top of the hand? The answer is B. At the bend of the elbow, middle of the arm. Number 114. What is the maximum amount of blood that should be drawn from a newborn? A. 1% of total blood volume, B. 5% of total blood volume, C. 10% of total blood volume, or D. 3% of total blood volume? The answer is B. 5% of total blood volume. Number 115. Which of the following procedures is used to collect blood from the capillaries? A. Venipuncture, B. Arterial puncture, C. Dermal puncture, or D. Butterfly needle collection? The answer is C. Dermal puncture. Number 116. What is the most important step in preventing the spread of infection during phlebotomy procedures? A. Wearing gloves. B. Washing hands. C. Wearing a mask. Or D. Using aseptic technique. The answer is B. Washing hands. Number 117. Which of the following tube colors indicates the presence of an anticoagulant and a gel separator? A. Red. B. Light blue. C. Gold or tiger top. D. Lavender. The answer is C. Gold or tiger top. Number 118. Which of the following is a common cause of blood specimen hemolysis? A. Using a needle that is too small. B. Vigorously shaking the blood tube. C. Drawing blood too slowly. Or D. Exposing blood to sunlight. The answer is B. Vigorously shaking the blood tube. Number 119. What is the primary purpose of the Clinical Laboratory Improvement Amendments, CLIA? A. To oversee workplace safety in laboratories. B. To ensure quality laboratory testing. C. To monitor environmental hazards in the laboratory. Or D. To promote professional collaboration among laboratory workers. The answer is B. To ensure quality laboratory testing. Number 120. Which blood vessels carry oxygen-poor blood back to the heart? A. Arteries. B. Veins. C. Capillaries. Or D. Arterioles. The answer is B. Veins.